It is January 2026. Welcome to Health Insurance After You Retire. My name is Garen Solbach. I'm one of the two healthcare facilitators at UC Davis. Nick Robledo and I are the two people at UC Davis who specialize in troubleshooting the use of UC health plans and coordinating them with Medicare. So we help people deal with their health plans, but we also help people plan for retirement around healthcare insurance and Medicare enrollment and coordination and all of that. And we're going to try to share some of that information with you with this presentation to prepare you for your future retirement. Briefly talk about what we're going to talk about. We're going to answer the following questions. We're going to tell you which health and welfare benefits can continue into retirement, how you become eligible for those benefits, how much service credits you need, what age do you need to attain, what rules do you need to follow, that sort of thing. We're going to talk about how much you'll have to pay for these benefits and how to calculate benefits as a retiree and anticipate rate changes when you get Medicare and that kind of thing. Speaking of Medicare, we will be talking about Medicare Parts A, Parts B, and at the end, Part D. We'll talk about all the parts of Medicare, how you enroll, how it affects your UC coverage, etc. We'll also address, is UC planning to cancel retiree health insurance? The answer to that is no, but we're asked that occasionally. So we're just going to go ahead and head that one off with a bullet here and address the UC contribution toward retiree health coverage toward the end of the presentation. And also at the end, we're going to specifically address the needs of July 1st retirees. As you may know, July 1 is kind of a busy season for retirement because many UC employees retire on July 1st each summer. Let's get into it. Let's talk about which health and welfare benefits you can continue into retirement, how you pay for those things, etc. This is one of the reasons that we work here at UC, is not just for our current pay, but for our future retirement and health and welfare benefits. Let's talk about the health benefits versus the welfare benefits. Eligible retirees may continue into retirement medical, dental, and legal. Now I know legal isn't a health benefit, but I include it here because medical, dental, and legal, those are the three plans that you can deduct from your UC pension check. The other benefits cannot be deducted from a UC pension check. So medical, dental, legal, those are the three where if you have a premium to pay, that premium will be automatically deducted from your UC pension check. Vision service plan, no, you cannot deduct that from a pension check. Instead, you need to pay vision service plan directly. So when you retire, after you retire at some point, you should receive a letter from vision service plan offering you specifically UC retiree VSP benefits. And if you want to sign up for those, you can. I will say that if you're going to be a July 1 retiree, for example, let's say you want to have VSP, but you're retiring July 1st, so you'll have vision service plan paid for by UC Davis through the end of July. I would suggest that you get all your eye exams and glasses and all that stuff done using your VSP in the beginning part of the year. You have between January and the end of July to take care of your vision needs so that you don't need vision service plan for the rest of the year. And then you could just use retiree open enrollment to sign up for VSP for 2027. That's actually the easier way to sign up for VSP, because otherwise, if you want vision service plan for August through December, you have to keep an eye on your mailbox. You will eventually get a letter from VSP, but we don't know when you're going to get that letter. It will definitely be after you retire, though. As you think about whether to purchase vision service plan, because it isn't free for retirees, know that Kaiser provides an eyewear allowance of $150 every 2 years for members with Medicare. So if you have Kaiser Senior Advantage, you have some coverage for glasses, but people tell me that Kaiser's glasses are still expensive even when they're $150 off, so you may still want to buy VSP. Vision service plan itself for retirees is not particularly expensive. It's under $13 for a single person. I think it's under $24 for two people. I don't have the rates in front of me right now, but they are low. So about those deductions, where would you go to see your deductions from your pension check when you're retired? Well, you would go to UC Raise, the UC Retirement at Your Service website, retirement@yourservice.ucop.edu. Not UC Path. UC Path is the employee database, right? That's for employees. If you're retired, you're being followed by the retiree database, and your window into the retiree database is the UC Raise system, which you can use to see your direct deposit statements for your pension, your 1099-R, that's the tax statement that you're going to need for taxes. You're going to need to use UC Raise for updating your contact information, for tweaking your tax withholding, making open enrollment changes, etc. It's a very, very helpful portal. Think of it as the UC Path for retirees. But when you're looking at those UC pension direct deposit statements, a very, very common question that we get, so I want to address it right now, is how to interpret some of the abbreviations that are listed on those direct deposit statements. When you look at the deductions and UC contributions section of your direct deposit statement, you might see Med MBR Preem. That means medical member premium. You, the retiree, are the member. So when you see Med MBR Preem, medical member premium, that's what you pay for retiree health coverage. That's your premium deduction. But when you see Med ER Preem, ER means employer, which means UC. That's not what you're paying. That's what UC is paying to cover you. Okay? You'll see that for the dental plan as well. But deductions will be spelled out on your direct deposit statement using these cryptic acronyms or cryptic abbreviations. So now you know what they mean. Member means you. ER means employer means UC. Now, something else that's important for you to do, so I'm going to give you a little heads up icon here, informational icon. You can keep your contact information up to date with UC using UC Raise, as we mentioned. But I also encourage you to make sure that the UC Davis Retiree Center, the local UC Davis Retiree Center, has your email address so that they can send you information every couple of weeks with local information. The UC Davis Retiree Center is a very helpful and important partner for the Healthcare Facilitator program because they host events that are related to our benefits, and they advertise Healthcare Facilitator program presentations and the like. So I really encourage everybody out there, give the Retiree Center your email address so that they can email you bi-weekly with their updates. We talked about medical, dental, legal, and vision service plan. Now let's talk about the other welfare benefits. Benefits like the Experian identity theft protection. That continues even into retirement, and UC continues to pay for it, so there's no charge to you. So it's same old for the identity theft protection. Not so for AD&D, the Accidental Death and Dismemberment Program. AD&D is like life insurance, except it only pays if you die in an accident or if you lose enough fingers and toes or that kind of thing in an accident so that the plan will pay. Of course, there's more information on AD&D on UCNet, but what I want you to know at this point is that if you're an employee who wants to continue AD&D into retirement, you're going to need to direct pay to the Prudential, our AD&D vendor. When it comes to life insurance, that's over. You cannot continue group life insurance through UC into retirement, but you can convert your group policy to an individual policy. I will warn you, I don't know anybody who has done this because it is very, very, very expensive to do so. Because if you are old enough to retire, you are old enough to have very expensive life insurance, unfortunately. Disability insurance ends the last day you're actively at work or on vacation, but of course, you shouldn't need disability insurance as a retiree. The whole idea is you are going to make enough money from your various investments and your UC pension, et cetera, so that you have income replacement while you are no longer working. So you shouldn't need it. When it comes to the Health Flexible Spending Account or the Dependent Care Flexible Spending Account, known as DepCare, those two FSAs, and when it comes to TIP, the Tax Savings on Insurance Premiums program that automatically puts your medical plan premiums pre-tax None of those are available, I'm afraid, to retirees. Those end. When it comes to auto insurance, home insurance, renter's insurance, boat insurance, if you want to keep that going, through California Casualty or Farmers or whatever it is that you have through UC, you can't continue it, but again, through direct payment to those insurance vendors. When it comes to the AFLAC style plans through the Prudential, known as the Accident, Critical Illness, and Hospital Indemnity plans, those are not available to retirees, I'm afraid. But pet insurance through Nationwide is. Again, you need to direct pay to Nationwide as a retiree. I want to help you figure out what you'll be eligible for as a UC retiree. UC employees can continue into retirement medical and dental insurance if you have enough service credit and you follow certain rules. You need to have enough UC retirement plan service credit, and you need to retire and take the monthly pension. You need to take the monthly pension to get health insurance. You also must elect that monthly pension within 120 days of terminating UC employment. You might think, oh, I'm 50 now. I'm going to quit and go do some other job someplace and then turn around and retire at 60 to maximize my pension. Yes, you can do that, but you won't get health insurance. You need to be working for UC when you retire. You need to retire within 120 days of terminating UC employment to qualify for UC's contribution toward medical and dental insurance, which we will be talking a lot about throughout this presentation. Your health insurance coverage must be continuous, so keep that in mind. Now, the other way to take your pension, instead of taking a monthly pension, is that you could take a lump sum cash out. But warning, if you elect a lump sum cash out, you're going to save UC a lot of money because you'll forfeit UC health coverage if you take the lump sum cash out. At UC, you can either take the pension and the benefits, or you can take the money and run, and that's the lump sum cash out. So watch out for that. If you take the lump sum cash out, no health benefits. Now, let's say you do leave the university without retiring, and you do want to eventually retire with health benefits. Understand that if you do that, if you leave the university, if you separate from the university, you do not retire, but then later you are rehired into a UCRP eligible position at UC, remember, you must work at least 12 months in a UCRP eligible position in order to qualify for retiree health benefits. And if you do that, and let's say that you're in an older tier right now, we're going to talk about the eligibility groups momentarily, but let's say you're in one of the older, more generous eligibility groups, and then you leave, and then you come back to work for us for 12 months so that you can retire with health benefits. Well, you may be in a more difficult eligibility group if you leave and come back. The idea here is that the benefits are designed to attract and retain employees. You are not rewarded for leaving and coming back. You are most advantaged by working here consistently for a long time until retirement. But if you do leave, you could come back for 12 months in a UCRP eligible position and get health benefits into retirement theoretically. When it comes to health benefits and pension at UC, when you joined the UC retirement plan matters a lot, okay? When you joined the retirement plan. And you might be thinking, but Garrett, I've worked here for a long time. How am I supposed to remember when I joined the retirement plan? Well, a way to think about it is, when did you get dental and vision insurance? Only retirement plan members get dental and vision. So you might have been temporary at first or in a short-term position at first, and then been hired full-time or been hired for a longer period of time and suddenly become eligible for retirement plan membership. The point at which you got dental and vision, that's when you join the retirement plan. Maybe that'll help you understand which of the following eligibility groups you belong to. If you've been here a long time and you joined our retirement plan before 1990, then you're in eligibility group 1. Retiree health eligibility group 1 is people who joined the retirement plan before 1990. Those people do not need much service credit to get 100% of the UC contribution toward medical and dental for themselves and their covered family members indefinitely Those people in group 1 who retire at ages 50 to 54 must have at least 10 years of service credit. Then they get 100%. If they are 55 or older when they retire, then they must have 5 years of service credit, and they get, again, 100% of the UC contribution toward medical and dental. Now, we're going to talk more about what 100% of the UC contribution means as we go along. But for now, let's move on to group 2. Most of us who are attending this presentation are probably in group 2. These are people who joined the retirement plan on or after January 1st, 1990. If you are in eligibility group 2 because you joined the UC retirement plan on or after 1990, then you are subject to the dreaded graduated eligibility, which means that you may not get 100% of the UC contribution. You may get some fraction thereof. We will be talking about that for sure. But you're subject to graduated eligibility if you retire with less than 20 years of UCRP service credit. If you have 20 years of service credit when you retire and you're in eligibility group 2, you get 100% of the UC contribution. Now, you might be one of our newer employees and you might be in group 3. Group 3 for retiree health benefits is those who join the retirement plan on or after July 1st, 2013. If you joined our retirement plan July 1st, 2013 or later, you're in eligibility group 3 and you are subject to an even more extreme version of graduated eligibility, which again, I will go into more detail about shortly. But for now, understand that group 3 members not only need 20 years of service credit at retirement to get 100% of the UC contribution, they also have to be at least age 65 when they retire to get that 100%. If they retire with less than 20 years or earlier than age 65, they're not going to get the full shebang. They're going to get some fraction thereof, which we'll talk about momentarily. And they don't get a UC contribution unless they retire at age 56 or greater. So you can see that UC has tightened up the eligibility rules over the years as budgets require. If you are in UC Retiree Health Benefits Graduated Eligibility Group 2, like me, that means that you joined the retirement plan between 1990 and June 30th, 2013. And your eligibility is determined by how much service credit you have at retirement. Age isn't a factor so much, but service credit definitely is. As you think about service credit, remember, the percentage of UC's maximum contribution is based on full years of UCRP service credit. If you have 14.9 years, that's 14 years, not 15. It does not round up. We're looking at full years of UCRP service credit. But importantly, if you are somebody who earns sick leave as an employee, you want to hoard that sick leave because at retirement it converts to UCRP service credit. That's right. Sick leave is worth service credit when you retire. So you don't want to waste your sick leave. You want to hoard it so that it improves your pension at retirement. Because let's say you retire with 25 years of service credit at UC, but you also have a year of sick leave on the books when you retire. That year of sick leave means that you're retiring with 26 years of service credit. So again, hoard that sick leave. Now let's look at the service credit chart we have here. If you retire and you're in group 2 with less than 5 years of service credit, you do not get a UC contribution. In fact, you can't even retire. You have to have 5 years of service credit to retire at UC. Okay? Now let's say you retire with less than 10 years of service credit, but at least 5. So you have at least 5 years of service credit, but you have less than 10. Well, for these people, we have what we call the rule of 75. And the rule of 75 says that if your age plus your service credit equals at least the number 75, then you get 50% of the UC contribution toward medical and dental, which I will illuminate later. So 50% if you retire at a late age and your age plus your service credit equals at least 75. So if you retire at age 69 with 7 years of service credit, that's more than 69 plus 7 is worth more than 75. you would get 50% of the UC contribution toward medical and dental for you and your covered family members indefinitely. Otherwise, you're not eligible because you need 10 years of service credit if you're in group 2 to get retiree health benefits generally, and 10 years gets you 50% of the UC contribution. 11 years gets you another 5%. It's 5% for every year above 10. So 10 years gets you 50%, 11 years gets you 55%, 12 years gets you 60%, 15 years gets you 75%, 19 years gets you 95%. It's 20 years that gets you 100% of the UC contribution toward medical and dental indefinitely. So obviously 20% is the ideal. But if you're at less than 20 years and you have 19 years, you get 95% of the UC contribution, that's still great too. We'll talk about how you can calculate those premiums so you can see what I'm talking about in more detail later in the presentation. Those of you who joined us more recently, if you joined the retirement plan on or after July 1st, 2013, then you're in graduated eligibility group 3. And if you're in group 3, it breaks out like this. Your service credit and your age matter. Okay? 10 years of service credit gets you 5% of the UC contribution at age 56, 25% at age 60, 50% at age 65. 20 years of service credit gets you 10% of the UC contribution at age 56, 50% at age 60, and 100% at ages 65 or greater. So keep in mind when you think about what you're going to pay for health insurance, if you're trying to get a sense of what percentage of the UC contribution you're going to qualify for, you want to be 65 or older when you retire. And of course, you want to have at least 20 years of service credit to max out. But if you don't, if you have less than that, then you're looking at some of these. This is just a general table that shows you the percentages as an example. But I will, in a little bit, show you exactly how to calculate these rates for yourself using an Excel spreadsheet. But for now, I want you to understand that this is what you'd have if you're in eligibility group 3. And that includes people who are rehired after a break in service, unless they retired. So let's say you left here at age, 55 and came back at age 60. Well, because you left and came back after July 1st, 2013, you're in group 3, even if before you might have been in group 2. So it's a disadvantage to leave and come back, okay? Try not to do that. The whole idea of these benefits is to attract and retain employees, and this is the retain part. Now, if you're a rehired retiree, let's say you leave the university, you don't just leave, you retire, you take your monthly pension. But then a job comes up that you just can't deny, or the chancellor calls you back to do a special project. If you're a rehired retiree and you stop your pension to rejoin the retirement plan as an active member, you will retain your original eligibility in groups 1 or 2 when you retire. Okay, so keep that in mind. There's a big distinction there. This first bullet is people who left and did not retire. The second bullet is somebody who did claim their monthly pension and then come back to full benefits at UC. Please take a look at the bar chart. This bar chart will become familiar to you as you go through the presentation because I'm going to use it several times to make points about the UC contribution. It illustrates the maximum UC contribution and other lower levels of contribution as we go along by showing the gold bar set to 100%. The gold bar is a representation of the UC contribution towards medical and dental insurance as a retiree. So notice that the gold bar is at the 100 level. The blue bar is a sample medical plan premium for somebody who does not have Medicare. The red bar is a sample premium for somebody who does have Medicare. Okay, so red means Medicare in these bar charts. Now, let's focus on the two leftmost bars. We have the UC contribution at 100%. We also have the blue sample medical plan premium set to 120%. It's higher. Just like when you're working, if you get 100% of the UC contribution, but your medical plan costs more than the maximum UC contribution, you're responsible for the net cost. That's the net cost, the difference between what the plan charges and what UC will pay. That's on you. And we'll talk about how to calculate that. I'm going to give you a very specific example next. Keeping in mind the previous bar chart, let's take a look at example A here. This example is for someone who gets 100% of the UC contribution. They are not subject to graduated eligibility. They get the whole shebang. You know, everybody's working towards that gold bar that I described in the bar chart. Well, this person has the bar all the way to 100. They get everything that UC will contribute. In this example, an employee retires with 20 years of UCRP service credit, and they're in Group 2, which means that they get 100% of the UC contribution. They are retiring with HealthNet, the UC Blue and Gold HMO, and they're covering a spouse. Neither the employee nor the spouse have Medicare. So this is a simple example. Somebody's retiring with HealthNet. They get 100% of the UC contribution. Well, everybody gasp at the same time when I say the total medical plan premium for HealthNet, the UC Blue and Gold HMO, for two people is almost $2,500. It's $24,449.31 per month. That's how much HealthNet requires to cover you with that plan. Very expensive. The maximum that UC will pay, the maximum UC contribution, is $1,621.82. Well, this person qualifies for the entire UC maximum contribution. But even with that contribution, there is $827.49 per month left over after UC pays its maximum, $1,621.82. So $2,449 minus $1,621 is the $827.49 monthly premium you're seeing for this retiree and their spouse. Of course, it could be worse. You could retire with less service credit so that you don't qualify for 100% of the UC contribution. Let's say you are subject to the dreaded graduated eligibility. Well, then you have a much greater net cost because the gold bar is going to be lower. In this example, we have somebody who's eligible for 50% of the UC contribution. The gold bar is set to 50%. Unfortunately, just because you work here 10 years instead of 20, your medical plan can't charge less. They have to charge what they charge regardless. So that leaves you with a much greater net cost. Whether you are non-Medicare or whether you have Medicare, you're looking at a much greater net cost if you do not work here the full 20 years and retire with 100% of the UC contribution. And depending on which eligibility group you're in, that could mean retiring later if you're in Group 3 to try to get that 100%. But in this example, let's focus on the net cost between the gold bar and the blue bar. This is somebody who gets 100% of the UC contribution. Here are the details of that 50% UC contribution. Here we have example B, somebody who qualifies for 50% graduated eligibility. They get 50% of the UC contribution because they're retiring with 10 years of service credit and they're in Group 2. 10 years gets you 50% under Group 2. So this person again has HealthNet, the UC Blue and Gold HMO, and is covering a spouse, and nobody has Medicare in the family. Again, HealthNet is still charging the same $24.49.31 per month. Yikes. But the UC contribution is cut in half. Remember, the maximum UC contribution in the previous example was $1,621.82. This person only gets 50% of $1,621.82, which is $810.91 off that $24.49 premium, leaving the net cost to the retiree of $1,638.40 per month. That is like a house payment, right? That's the difference between what HealthNet charges and what UC was willing to pay for somebody who gets 50% of the UC contribution. So if this does not convince you to work here longer, I'm not sure what will, but let's continue. We will talk about how to calculate those numbers that I just gave you as examples. But first, there are some things you need to know in general about UC retiree health plans. First of all, we're talking about the same medical and dental plans we were talking about when you were working, right? Now, there are some exceptions due to Medicare, which we'll talk about as we go along, but don't expect some hugely different menu of medical and dental plans. It's pretty much the same when you retire, unless you have Medicare, and then we'll talk about those differences. Something else you need to know is that the eligibility rules for which family members UC will cover, those rules are the same. So UC covers spouses and children and adopted children and stepchildren and grandchildren and overage disabled children. Those rules are all the same. And you can find all those eligibility rules on UCNet, of course. But something else that's the same for employees and retirees is that UC contracts with a company, a third party called Unify HR, to verify the eligibility of those family members. Because we've had way too many employees get a divorce but fail to disenroll their ex, which costs us thousands over the course of years, UC started contracting with Unify HR several years ago to verify, hey, are you still married to that spouse? Is that grandchild still your tax dependent? That kind of thing. In order to verify that these dependents are still dependents, you may be contacted by Unify HR. Now, it will be co-branded. The mailing that you'll get will be co-branded with University of California logos. But when you see Unify HR, you need to jump. You need to take it very seriously and get in the tax statements or whatever other documentation Unify HR will need to verify that you, yes, are still married to that person or that grandchild is still your tax dependent, that kind of thing. Something that you might want to know is that your survivors may continue health coverage even in the event of your death if they are eligible for a survivor's pension. One of the most important benefits that UC offers, one of the biggest reasons to work here, is that UC takes care of your family members. Your survivors, if they are eligible, will not just get the pension. If they get the pension, they also get the health insurance. And during this presentation, I can't go into all the rules about who can be a survivor. That's for someone else to teach you. But understand that this is a very, 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 very valuable benefit. Your survivors can continue health coverage, and they are set up as if they are the retiree if they qualify for your survivor's pension. So you might leave behind a spouse, but that spouse might be getting a portion of your pension or maybe the same amount that you were getting as your pension and health insurance. It's a very, very valuable benefit. But I want to give you a heads up. This little information logo is to give you a heads up about something. I want you to understand that if you are going to retire and if you will be eligible for retiree health coverage, you're going to get a couple of letters that we cannot suppress. And I want you to ignore these letters. One of them is your medical plan termination letter. Anytime UC Davis stops paying for your health coverage, anytime a campus or UC Path stops paying for health coverage, you have to get a letter that says your coverage has been terminated because you need to be notified of such a thing in case you didn't know. Well, that termination letter is useless to you if you will be eligible for UC retiree health coverage because yes, your UC Davis / UC Path / campus-based coverage is going away, but it will continue into retirement through the UC retirement system. So you're safe to ignore that medical plan termination letter that we cannot suppress when you retire. Don't let it stop your heart. The other letter, the other packet really that you might ignore if you're going to be eligible for retiree health coverage, you will automatically get a COBRA continuation offer from a company called WEX, W-E-X. That's the name of a third party that will send you a COBRA packet, which if you read it carefully will say, if you're eligible for UC retiree health coverage, please ignore this letter. But a lot of people don't see that, so now you know. I'm giving you a heads up, an informational heads up. Ignore the medical plan termination letter from your medical plan and the COBRA continuation offer from WEX if you will be eligible for UC retiree insurance, because we cannot suppress those letters. This last bullet, no salary banding, has to do with how much you pay for employee coverage. UC salary bands employee health benefits, right? Your medical plan costs more if you make more. It costs less if you make less when you're an employee. But we don't do that when you're a retiree. Retiree health plans are not salary banded because we don't know which retirees are high income and which are low income. Because the pension that you get from UC, that might only be a tiny part of your whole retirement picture, with Social Security income and retirement income from other sources and retirement savings account income from your 403b plan or whatever. We don't know how much money retirees really make in the big picture, so we don't bother salary banding when you are a retiree, only when you're working. So keep that in mind. You might actually pay less as a retiree if you're in a high salary band when you're an employee, because there is no salary banding for retirees. Something that's also similar when you retire and are eligible for retiree health coverage is when you can change health plans. Guess what? Retirees have the same open enrollment that employees do. The UC open enrollment is always the end of October, ending the Friday before Thanksgiving. Every year, every fall, you have the opportunity to make changes that are effective the following January 1st. Okay? But when you're retired, I want you to focus on the UC open enrollment, not Medicare's general enrollment period or Medicare's fall enrollment period. The Medicare open enrollments are not useful to you as a UC retiree unless you are covered by VIA benefits, which I will talk about in the Medicare section. And that's for people who live out of state. Medicare's open enrollment and all the marketing that's done by different Medicare plans on billboards and the radio and to your home and on your TV, all that stuff is for people who live in the real world. And UC retirees do not live in the real world. They live in the UC world, where coverage is better unless they move out of state and they go to coverage through VIA benefits, and then they have real world coverage, and then Medicare's enrollment periods do matter to them. But for most of us, just ignore the Medicare open enrollment periods. You're going to pay attention to the UC fall open enrollment, just like always when you were an employee. Other things that you should know. You can suspend your medical and or dental coverage as a retiree. And that's not something that you can't undo. You can always re-enroll during open enrollment, or if you can prove the loss of other coverage. But it's something that you might want to do if you're going to retire from UC and then get a better deal through a spouse, or get a better deal from another job that you might be retiring from UC and going to another job that offers you affordable health coverage, and you might not need our coverage. So yes, you can suspend your coverage and then get back in later. Something to know though, if you're two employees who are married to each other, we have a lot of employees who are married to other employees. Understand that you can't double cover, right? But one of you can cover both of you, or you can each cover yourselves. But in case this information is useful to you, because often it is less expensive to get coverage as an employee than it is as a retiree. If you don't have Medicare, that's usually the way it works. Know, married employees, that if one of you retires, the employee who remains working for UC can add the retiring family member. So if you're both working for UC and one of you retires before the other, the one who keeps working can add the retiree to their coverage. If it saves you any money, you might want to take advantage of that. Now you know you can do it. Okay? But there are other opportunities to change health plans, and they are generally around major life events. If you have a major life event that generates a 31-day period of initial eligibility, that is the 31 calendar day window for you to make changes to your coverage, then you can make changes to your coverage. Just like now, you would reach out to UC Path if you got married and wanted to add your new spouse, you'd have 31 days to add the new spouse. When you're retired, you do the same thing, except that UC Path doesn't serve retirees. The RASC, the Retirement Administration Service Center, controls your benefits. The retiree database, your interface being UC Raise, they control your benefits. And I, Garen, and Nick Robledo, the two healthcare facilitators at UC Davis, we will help you with these transitions. For example, let's say you have a new grandbaby who will be living with you and will be your tax dependent, and you want to add that newborn to your health coverage as a retiree, or you want to add your new spouse as a retiree. Reach out to me, reach out to Nick. We help people with the paperwork all the time, and we'll tell you exactly what you need to fill out and submit to the RASC to enroll newly eligible family members. Something else you need to know is that let's say you're not covered by UC. Let's say you suspended your coverage, but now you need our coverage because the coverage that you were relying upon was through your spouse, and your spouse is now retiring. Well, even if your spouse is voluntarily retiring from a job, we consider the loss of their coverage, their medical coverage, to be an involuntary loss. So in the benefits world, we call it the ILOC. You're going to invoke an ILOC, an involuntary loss of other coverage, which means that you're going to have 31 calendar days as of the date you lose coverage to invoke benefits at UC and get paperwork in. Of course, when possible, if you can do this stuff in advance, I would advise it. And Nick and I will help you with the paperwork, of course. But you always have the 31-day PIE to make changes to your benefits when you have a major life event. Here's an example of a life event that might occur to you. If you or a covered family member obtain Medicare, but you're covered by a plan that is incompatible with Medicare, which in 2026, that means the Health Savings Plus PPO, then you can't keep the Health Savings Plus PPO. You have to change medical plans if you have the Health Savings Plus PPO because it has an HSA, a health savings account that is not compatible with Medicare. If you're in the Health Savings PPO as a retiree and somebody in the family gets Medicare, we have to give you what is essentially your own personal open enrollment to choose any Medicare plan you want. Again, give us a call, give me a call and I will help you out with these transitions. Something else to know, retirees do not sit still in my experience. As soon as people retire, they're traveling all over the place. And even if they're not in high travel mode, they might be visiting grandkids or children in other areas. So that retirees just don't stay still in my experience. Let's say you have an HMO. You need to understand that HMOs are prepaid medical plans that only really work where the prepaid doctors are. So if you're in an HMO and you're going to be outside the service area of that HMO for 2 or more months, then you are supposed to change medical plans to something that will cover you where you're going. Nick and I will help you switch from HMOs, prepaid medical plans, to health insurance. Whenever this comes up, you just let us know. We'll help you understand the options and we'll help you with the paperwork. At long last, let's talk about how you can calculate your premiums as a UC retiree. Well, I want to direct you to the Healthcare Facilitator Program website. Our website is hr.ucdavis.edu/HCF. And you're going to find a couple of Excel spreadsheets that you can download from that website. We break things down into who, what, when, where, why in the middle column of our site. And under how much, you're going to see a link to employee rates, but also links to retiree rates. And one of the links to retiree rates is a link to this Excel spreadsheet, the UC Retiree Premium Estimator. This tool is very useful because it will not only tell you how much you're going to pay for your health coverage, it will help you understand what percentage of the UC contribution you'll qualify for, and it even links to my favorite Medicare premiums chart. It's my favorite because I consider it to be the easiest to read for those who have Medicare or who have family members who have Medicare. The Premium Estimator is a tool that you can use to figure out what the premiums are for just you, for you plus a spouse, for you plus a spouse plus a grandchild or plus a child, you plus a spouse who has Medicare, you who has Medicare, but covering a spouse and a child who doesn't have Medicare. All those combinations are addressed by this estimator tool so that you can figure out exactly what you might pay if you were retired in 2026 and what percentage of the UC contribution you'd qualify for if less than 100%. And the tool links to Medicare premiums. You have to factor in how much Medicare costs because Medicare Part A is free, but Medicare Part B is definitely not free. And it's really, really not free if you are super high income. If you're in the top 7% of earners in the United States, Social Security charges you more for Medicare. And that link to that Medicare premiums chart will help you understand that. But there's another Excel spreadsheet that is useful on our website. If you are moving or if you are trying to figure out what medical plans are available where, we have a useful tool for you called the UC Medical Plan Availability Tool. This tool will tell you, if you download it, it's an Excel spreadsheet, if you enter a California county and overlapping zip code, it'll tell you whether there's an HMO available there. HMOs, geography is destiny with HMOs because HMOs are prepaid medical plans that prepay a medical group in a particular geography to take care of you. So this tool will help you figure out whether an HMO is going to be available. Well, I'm going to give you a heads up right now. HMOs are only available in about half the counties in California, the urban counties. Okay? You're not going to find HMOs north of, say, Santa Rosa or Woodland or Roseville. I mean, you can't move to Chico to be near the Sierra Nevada Brewing Company and keep an HMO. You'd have to switch to health insurance, a PPO, if you were to move to Chico, for example. You can't move to Truckee or Sonora or, places in the desert in Southern California. It's got to be urban California for you to have an HMO. And that tool will help you understand what plans are available anywhere, whether you're thinking about moving out of state or you're going to be moving to rural California or you're just going to be spending a lot of time in a different part of the country. We have a lot of snowbirds, if you will. We have a lot of retirees who spend time on the East Coast and the West Coast, depending on the season. This tool will help you understand what your medical plans will do for you, which ones will be available when you do things like that. So those two spreadsheets are helpful. But I also want to warn you about something. Here's the warning symbol. This is especially a warning for people who might come back to work for UC part-time after they retire. If you're a faculty member who might come back on recall, or you're an employee who might come back to work on a project or help your department out for a little bit, understand something. If you are rehired within 6 months of retirement, you will still be eligible for health insurance as an active employee. And you might think, well, why is that a big deal? Well, it's a big deal because under federal law, health insurance through active employment is primary over Medicare. And most of our retirees have Medicare, so we have all these policies having to do with it. And one of those policies says that if you come back to work within 6 months of retirement and you're eligible for health coverage as an active employee, even with your minuscule amount of hours that you're going to do, your retiree medical plan is going to have to stop. So UC Path would alert the RASC, and the RASC would stop your medical insurance. And then you would have to get medical coverage through UC Path by responding to an email that you get from UC Path offering you employee health benefits as if you're a new employee. Now, you'd be eligible for any medical plan you want, but you wouldn't be able to keep the retiree coverage. Now, if you don't have Medicare, that might not be a big deal to you because you might actually pay less as an active employee than you do as a retiree for your non-Medicare medical plan. But if you do have Medicare, what you may find as you go through this presentation and learn more about our retiree health plans, our retiree health plans for those with Medicare, they tend to be better than any active employee health plan. So that means that you might have this amazing Medicare plan as a retiree that would stop, and then you'd have to get just regular employee coverage, and then you'd have to decide whether to keep paying for Medicare or whether to suspend it and that kind of thing. And if you're a rehired retiree and you come back at less than 43% time, you might be eligible for employee benefits if you come back to work within 6 months of retirement. But even if you are, you won't be eligible for that long. So this creates a lot of work for you, because you might lose your retiree health benefit, choose a plan through UC Path, then the UC Path coverage ends after a few months because you're not working that many hours, you're on recall. You're a rehired retiree. You're retired. Well, then you'd have to re-enroll through the retirement system. Anyway, it creates a lot of work. And the big flashing warning sign here that I want to give you is this 6-month requirement. Try not to come back within 6 months. That way, your retiree health benefits will not be affected. If you want employee medical and you don't want retiree medical, then by all means, come back within 6 months. But if you don't want your Medicare coordinated, super sweet retiree health plan to be impacted, restrain yourself. Wait at least 6 months before you come back to work for the University of California.